My name is Robert Burns. I'm a professor of healthcare management here at the Wharton School at the University of Pennsylvania. My colleagues and I are publishing a paper on physician preference items, or PPIs, and asking what are the dimensions of physician preference items. You know, it's a topic that's long been discussed for the last 15 or 20 years on the importance of PPIs. The fact that they're a major share of medical device costs, they're the fastest rising component of medical device costs. They require hospitals to partner with their physicians in the selection and purchase of these products, and yet basically little is known empirically about PPIs. So my colleagues and I set about to try to rectify this situation. We obtained a list of all the surgeons in the Commonwealth of Pennsylvania performing hip and knee implants for a given year. And then we looked through that database to find physicians who were doing at least 12 of these procedures a year, suggesting that they did this more than infrequently. And then we used that as our sampling frame, and we surveyed them all about their use of hip and knee implants, which vendors, why they prefer one vendor's products over another. We obtained a 40% response rate to this, and then we sent out a survey to them asking them to articulate their preferences for medical implants. What we found is that physician preference items basically have a lot of common characteristics that are constant across different types of orthopods. You know, their gender, their training, the volume they do, things like that. So rather than being idiosyncratic preferences, physician preference items have commonalities across physicians. In other words, the same characteristics are expressed in terms of why I prefer this implant over another implant, regardless of the type of physician and the volume they do. The other thing that we found is that they are commonalities across the types of implants, hip implants, knee implants. They both have the same configuration of preference ratings to those implants. And then thirdly, what we found is the vendor of the implant really doesn't matter. The physicians say the same things about the reasons why they prefer hip and knee implants across all of the major vendors, and there are no real significant differences between them. So our basic conclusion is that we try to demystify what physician preference means in the selection of medical devices like hip and knee implants. There are basic commonalities across physicians, across vendors, and what physicians are looking for in the implants that they choose. The preferences are more about the implant and the sales rep who's helping the physician with the implant, not about the vendor or the cost of the product.